Okay, today I'm going to be showing you some shoulder tests that test for basic shoulder pathologies like rotator cuff tears, impingement, slap lesions, or bursitis. So the first test I'm going to show you is the RENT test. You have your patient seated and you palpate the anterior and posterior aspects of the acromion. You bring their arm into extension and you move it into internal and external rotation. And if there's a depression in their acromion more than a centimeter, it's positive for a torn rotator cuff. The next test is the lift-off test. So you have your patient seated, you tell them to place their hand on the small of their back, and you ask them to go ahead and try to lift your hand off of your back. If they are unable to lift their hand off of their back or they have some difficulties doing it, it can be positive for a subscapularis tear. The next test is the NEAR test. It tests for impingement, bursitis, rotator cuff tears, or superior labral tears. Your patient is seated. You raise their arm into flexion. You stabilize the scapula, and you force flexion towards the end range. If pain is present, then it is positive for impingement. The crank test is what I'm going to show you next. It is for torn labrums or slap lesions. The patient can be sitting or supine. You abduct their arm to 160 degrees, their elbow to 90 degrees, and you apply a compressive force onto their humerus, and then you internally and externally rotate their arm. If there's pain with or without a clicking sound, it is positive for a torn labrum or shoulder instability. The last test I'm going to show you is the Hawkins-Kennedy test. It's testing for subacromial impingement mostly, but it also can test for other shoulder pathologies. Your shoulder can be in either 90 degrees of abduction or of flexion. You need to stabilize the scapula, and then you apply internal rotation force. If there's pain, then it is a positive test for subacromial impingement. And those are the shoulder tests.